conversation.
This is Dr. Dassani, and she is the wonderful author of Healthy Sleep Habits for Kids. Dr. Dassani, can you please?
You're so funny, you're cracking me up. All right, so I am a general dentist, and we see patients of all ages. We see babies from when they have their first tooth come in to adults who don't like to adult, or really big babies, as I call them. Our practice does every procedure that we possibly can in dentistry. We pull teeth, we do fillings, crowns, cosmetics, we see kids, cleanings, all of that. My journey into sleep apnea started because of a personal loss. And we started to see adults with sleep apnea. We started to help them sleep better. And slowly we had patients, parents, moms, grandparents ask, can you do this for my child too? And for those that don't know, sleep apnea is when we stop breathing for 10 seconds or more multiple times throughout the night. Basically what that means is there's some form of obstruction. In kids, it's your tonsils. In adults, it's excess weight around the neck or a tongue that falls back. And when you're stopping breathing, that brain isn't getting the oxygen it needs.
Right.
It presents differently in different people. In adults, snoring is the most common sign. So I tell parents this: if you have a child that snores or somebody that is a loud breather, so for teachers, if you can hear a child breathe, we got a problem. And this is not just, oh, I'm stuffy today and I can't breathe, but this is, you guys have them for years.
Yeah.
So if you have a child that is a audible breather, that has to make an effort to breathe or is breathing through their mouth, that is usually the first sign that there is an issue. And how does this present in people? Adults, we're usually tired, sleepy all day long, falling asleep at the wheel, puts you at a higher risk for stroke, heart attacks, high blood pressure. And I don't know about you, but I do not want to be on the road or on the plane with a driver or a pilot that's sleepy or sleep deprived. They need help. When adults are tired, we go to sleep. But when kids are tired, and you know this,
They act out.
they go in the opposite direction. They act up. So kids can have sleep apnea. They can be born with sleep apnea. Not all kids will present with the exact same symptoms though. When they are sleep deprived and their body isn't getting enough oxygen, some of these kids might snore. Some of them, the parents will notice choking or gasping in their sleep. More commonly though, we see ADD or ADHD symptoms, because the signs and symptoms of a child that is sleep deprived are the exact same as that of a child that has ADHD. How do you know?
Right.
And I tell parents this: maybe they need the medication, maybe they need the help that the medical side of the community is able to provide them. But unless we have that sleep evaluated and getting them to get the right quality of sleep and the right amount of sleep, you don't know.
Right.
So we always start there before you go towards medicating. It could be a child that you suddenly see they're going backwards in how they learn, or don't get along with their peers. You're constantly having to tell them, be nice, or handwriting starts to slide, or if we have an older child that starts to wet their bed. It's not your 3-year-old that's having a regression. This is your 3rd, 4th, 5th grader that suddenly has accidents. This is just because your brain isn't able to produce the hormones, the neurotransmitters it needs to prevent this from happening. So when we look at adults versus kids, if they're both not getting enough oxygen, this group's going to act differently. And yes, we can help them with that. But the kids, sadly, a lot of times as parents, we go, they're going to outgrow this, or just being a toddler, or just being a boy, or just being a teenager. Well, no, look for patterns. Is something different? And as parents, we know that there's something going on. So look for answers beyond just you're just lazy and you won't go to the bathroom.
Mhm.
Maybe there's something else going on. So those are the main things that we want to look for in children. ADHD is a big one. I am a huge proponent of making sure that sleep is evaluated before we get them on any kind of medications if they need. And believe it or not, your dentist can help.
So what does the process go to evaluate their sleep? What does that look like for a child?
There's subtle clues that we can pick up in the dental office.
Mhm.
Are their tonsils enlarged? Or do they have crooked teeth? Believe it or not, that is one of the signs that tells me that growth isn't happening the way it needs to happen. We evaluate for tongue ties because the tongue acts as a natural expander and retainer for the roof of the mouth. Guess what? The roof of the mouth is also the floor of the nose. If I have a constricted roof of the mouth, I don't have much airflow going on here. But if you can get that to grow, I just opened up their nasal passages. Constant ear infections. Babies, for moms that have babies that have trouble latching on, cannot nurse. Look into that because a lot of times we can help. So to answer your question in a roundabout way, there's clues that we look for when we're doing their cleaning, when we're doing an examination. If we do identify certain signs and symptoms, the next step is either seeing an ENT to make sure the tonsils aren't causing the problem, or getting a sleep study, which tells us, is there an issue? Now, word of caution there, yes, that is going to give us a diagnosis, but if we still have what we're noticing within the mouth, you still got to fix it. Because the solution for sleep apnea, be it in adults or kids, is a CPAP. It's the mask, the hose, the whole 9 yards. Well, in kids, that is going to hamper growth because we have this that's tied around, tight. What is it doing? It's not letting this grow. So when I can't have their jaw grow, we're inhibiting growth of the face in the direction it needs to, which is why your dentist has to be the quarterback. We have to work with ENTs, their MDs, their pediatricians, whoever it is, but we are able to guide parents into where they need to go so the child is able to get that growth.
So even the children have the face mask.
They can. I don't like for it to have
What are
that.
alternatives for that instead of the face mask?
Grow your face. Just grow that airway, be it with expanders, be it with other appliances or other means that we can help them with to just enlarge that space. I liken it to having a parking spot, right? I'm trying to park my SUV in that compact spot. It's not going to fit. How about I just make a bigger parking spot, which is where we can help. Good. Ish.
Now I'm concerned for my sleep.
Oh, good Lord.
I had another question and it totally just escaped me. So you were talking about ADHD, that a lot of people diagnose that first and then they just need to they can go to their dentist, they can go to the ET to get that sleep study done. A lot of kids have those Fitbits now. Is that an accurate description of their sleep? If they're seeing a lot of breaks in their Fitbit on a child?
That is a good screening tool to begin with. Because yes, sleep studies are, they got to spend the night at the hospital. They're expensive. And sometimes with kids, we may not get the full picture because their bodies are incredibly adaptable towards making sure they're getting past that. So I will see kids where I know there are issues going on. Mom has noticed them stopping breathing. Sleep study comes back, they're perfect because their body is able to adapt to it. So that is a good tool, a screening tool. It's like, maybe we might have an issue, but getting all of the other issues resolved. Like I said, sometimes it's getting the tonsils out. We don't know.
And it is something that they can grow out of or curable-ish.
The grow out of, the way I look at it is, are we okay with a child not getting all the oxygen they need? The answer to it is no.
But is there something that we can do to make sure, other than the face mask, that's what they do now, but will they eventually learn to?
That is where we can help grow their airway. So they have to get appliances, they have to get treatment done. I don't prefer for them to have the mask because it's actually going to, it's two steps backwards, yeah. But getting into the dental chair, getting us to evaluate that, address that, which we can, that's what we deal with. We deal with head, face, and neck.
Right.
We deal with how it's supposed to look, how you can help it, how you can grow it, how you can modify it. That's our specialty. It's not just teeth. People forget that. A dentist does more than just teeth. So we can actually grow that area. We can actually grow their jaws, direct growth, because these kids have all these massive growth spurts. It's like you turn around and now they need 2 sizes bigger pants, right? Because they've just shot up. So we utilize those growth spurts to get them to where they need to go.
Awesome. Is there anything else that you think we should know or parents should know, or signs that they should see? Even our educators out there, something that they should know.
So educators, this is what I basically say. If you have a child that is constantly acting up, or you see that learning is going backwards, or handwriting is going backwards, think about that and bring it up, because y'all are the ones that talk to parents. Say, hey, maybe, how is your child sleeping at night?
Yeah.
And for parents, I tell parents this, the easiest way to know is go into their rooms at night when they're asleep. If you notice them sleeping like that, or they're snoring, or the audible breathing, record it. Take it to their pediatrician or their dentist when you see them next and say, this is what I noticed. Is there an issue? Do you think this might be a problem? And let those that are trained for this actually guide you into what needs to be done.
Awesome. Well, I will definitely be letting our teachers know. I appreciate your time.
Thank you. Yes.
Thank you.